Okay, so now I'm going to teach you something that they don't really teach you at the hospital, unless you've seen a physical therapist, and unless they're really being very specific with you. They're going to be very generic in their instructions on how you're supposed to just get in and out of bed. And doing something as simple as turning from your left side to your right side it can be quite difficult if you're being told not to twist, bend, push, pull, or lift anything. And not only that, you're going to be in pain. All it takes is just a slight torque, and you will feel it. So what I'm going to do here is I'm going to show you how I went about traversing this environment without hurting myself. First and foremost, I would always have the bed set up so that I could get into it properly. Before I actually had my surgery, I went ahead and found out exactly the perfect way for me to sit, for me to lay down comfortably. And that way I always knew exactly where to put my ice pack. You never want to guess, because once you get into the bed, trying to lift your back up and move the ice pack up and down your body can be very difficult. You want to know exactly where to stick it. Okay, so this is where I always have my ice pack. Okay, so getting into bed is quite simple. Remember, this is for under the knees. If you're going to use this Posturepedic pillow, which is worth it. It's worth every single penny. You want to have the big fat part at the bottom, and this is right where it's placed at. It sticks pretty good. Okay. All right. So, quite simply, you sit on the edge of the bed very carefully, and as you lean, your legs are going to kind of lift up, and you're going to do the barrel roll. This keeps you from doing any bending or any twisting. Okay? So if you watch very carefully, oh, and one last thing. Keep your knee pad for the next 4 weeks right there. Always have it there. When you take it off, you stick it there. That way you always have access to it, because you can't reach down to get it. So have everything, whenever I'm laying in bed, I have always everything at reach. I got all my remotes, the remote, the computer, the phone, everything's within reach. Okay, so here we go. Quite simply, I just roll. I would even use this leg here to kind of help prop and get this one over. And then with one smooth motion, I use my elbow and my knee to just roll right over. And I promise you, once you master this, it takes a few times, you'll know you've done it right when you have zero pain. Now, if you look real closely, if you come on over, if you notice, the ice pack is exactly where it's supposed to be for this discectomy. And the pillow is exactly where it's supposed to be. If you look real close, I can't bend down to pull it where it's supposed to be. So you need to make sure you know exactly where you need to have it set. Okay? The next thing you do, like I said, not your pillow, or not the, I don't know what this is called, but not this cushion. So that it's always here. I love this thing. It could have been better. Unfortunately, it's not enough. So I always have one big pillow with me. Okay? Now, it's hard to sit in this position and lay in this position all day long for 2 or 3 weeks straight. You're going to want to turn left to right. When I had my sciatica issue, I couldn't turn left to right. I slept on my back for 8 months straight. But once I had surgery, I started realizing that I could turn without pain. So, here's one of the things I always made sure that one, it's hard for me to turn to the right side because I don't have anything to grip. Most of this stuff is pretty loose. I usually did most of my sleeping on the left, because what I could do is grab the bed and do a one-move barrel roll. Once I did the barrel roll, not only would I have this pillow in between my legs, but also this one. And by hugging that, and notice how perfectly that's right on the neck, I can't tell you how comfortable this is. In the middle of the night, you're going to find yourself, especially as you start weaning yourself off the pain medication, you're not going to be sleeping very well. So you're going to be tossing and turning. You need to get used to doing this the proper way, because you're not going to, when you're so sleepy you don't really know what's going on, that's when you're going to hurt yourself. Alright, so when it's time to turn, remember, it's that one movement. And sometimes I'll just kind of shimmy myself over. The only problem is turning that way has been difficult. And for the first week, my wife and my son, they would come and help me. They would literally help push me over to the side so I could sleep. If anything, the only other suggestion I might have, especially if you're living alone, is just tuck in your sheet real tight on that side so you can use it as leverage. Because what you don't want to do is turn one part of your body and then the other part of your body. You will feel it. Anyway, okay, so it's time to get up in the morning. Take my pillow, stick it right up there. I'm going to do my turn over again. Get myself all set up one more time. Now I'm going to use this hand. I'm going to push up with this, and I'm going to let my legs fall. I'm going to do it in one smooth motion to keep my body from doing any twisting or turning. And then from here, slow moving up. Very simple. One last thing. The more covers you have, the more difficult it's going to be to move around. If it's not too hot or too cold in the house, try to be as cover-free as possible. The more you start getting wrapped up in the stuff, especially when you're sleeping at night, and you'll find that you're stuck unless you're willing to wake somebody up. And if you're doing this on your own, it's very difficult to get unstuck. Okay? Well, I hope this whole video has helped. I can't really think of anything at the moment right now that can help more than this, but I can say that I needed a little bit more guidance during the time after my surgery. So hopefully this will help you out. My suggestion to you, don't lift a thing. Walk as much as you can without pain. And don't bend, don't twist, don't turn. And I hope you have a safe and wonderful post-operative experience. Last but not least, there's a lot of stuff out there that's scaring people from getting these surgeries. I can tell you right now, it's the best thing I've ever done. To be pain-free after just 1 month of this versus the 8 months that I was filled with pain and causing my family and my life so much anguish, having had this surgery has been the best thing that's ever happened to me. So don't be afraid of it. Don't go out there and start reading all this stuff that says it's the scariest experience ever. It was quick. It was not as painful as I thought it was going to be. And believe it or not, 8 months of sciatic pain is nothing compared to the mild issues that I had afterwards. Thank you very much.